other things that we need to know as we move through 2010 before we start heading into 2011?
I'll start out. One of the things that becomes effective during the 2010 year is that insurance coverage will have to be changed to include dependent adult children until they reach age 26. As all of you probably have had in your prior plans, if children who were above age 18 but were still full-time students and whatnot, they could still be on mom and dad's health insurance until usually 23 was the age where they aged out of the program. This has now been extended to age 26, and it doesn't matter if the adult child is married. So you could have a 25-and-a-half-year-old who's married, living away from home, and that person could still be on your employee's health insurance coverage. Some of you probably have policies that say to qualify for that they have to be full-time students, and I think probably if that's the case you need to be sure that your plan documents are getting revised, because that's no longer a requirement.
And Terry, just one comment to that. If your plan is fully funded, the health insurance companies are evaluating how to implement, because some of these provisions will require action on their part in a fully funded environment. And I've seen a notification from a couple of insurers just this week that they're going to go ahead and do a preemptory modification to plans that are fully funded, fully insured plans, and implement that dependent age change in advance of your anniversary that you would legally have to then comply. For example, Cigna is approaching this as a June 1st effective date across the board for all of their fully insured plans. They're going to go ahead and make modification to allow dependents to age 26. Now, it's not your plan anniversary. You have plan documents and information that then won't be consistent with what your health plan is doing, and that's where you need to have a conversation with Terry in terms of what your legal obligation is going to be to make your plans consistent with that change that's now being engineered by your health plan. So that's one thing that's getting a lot of attention right now, is relative to dependents and what the insurance companies are doing on their fully insured books of business.
And of course, with any luck at all, you will have had some adult child who will have aged out of their coverage, who's still within the applicable age range, and now you have to bring them back on. So that'll be fun. Another provision that goes into effect during 2010 is an early retiree reinsurance program. This is a benefit to employers who have an obligation to provide health insurance benefits to retired people between age 55 and 64. They don't qualify for Medicare yet, but they're in that age where they're retired. And if you are still providing benefits to some folks in that group, then there is a $5 billion set aside that helps employers recoup some of those costs. And it is going to stay in effect until either January 1st of 2014 or until the $5 billion is gone. And being in that age group myself, I think we can safely call this cash for clunkers, and assuming that so if you qualify for some of those benefits, you probably need to get your application on file with Health and Human Services, because that's where you get reimbursement for those expenses.
You know, had I said that, I would have been slapped.
See, you're not open.
Well, and just an additional note on that. A lot of the questions we're getting on the early retiree was a bit of a misperception that this mandates employers to offer early retiree coverage, and it does not. This is an option that will assist employers that do offer that coverage to help offset some of the costs. So it's not a mandate that you must provide that level of coverage to your employees.
As Karen previously said, the appeals process is going to change. It's kind of been typical for all kinds of ERISA-covered programs previously that there had to be an internal appeals process, and everybody's kind of used to how that works. Now the statute says there also has to be an external appeals process. It doesn't provide much in the way of guidance on who is going to run that appeal or how it works, but we should expect to see something about that in the regulations as they get issued by the relevant agencies.
Clinton, did you?
You want me to talk
I'm
about-
sorry, the tax credit?
Yeah, that's what I was going to ask if you want me to talk about tax credit. So I believe we have a lot of large employers here today, so don't zone out. I'll just take a few minutes. But I want to talk about for small employers, there's a subsidy to provide health care insurance through the form of a tax credit. And for the first 4 years, for 2010, 11, 12, 13, first 5 years. No, first 4 years, through 2013, that tax credit is up to 35% of the premiums of the employer's premiums that they pay for health insurance. If they have, you get the full credit if you have less than 10 employees and less than $25,000 of annual compensation. This is one of the issues where Terry spoke earlier about how do you define employees. And for this purpose, what you do is you take total number of hours worked by everyone, divide by 2,080, and that gives you what's called your full-time equivalent. And so for the purpose of this tax credit, that's the definition, which is different than 3 others that you mentioned earlier. And that's kind of the way this bill is. There's a lot of different mechanisms they use. So the tax credit is available then up to 25 full-time equivalent employees and an average compensation of $50,000. So what happens is you calculate the credit, and then there are 2 different phase-out calculations that you have to do to determine how much to take off if you're over the 10 and over the 25,000. In 2014 and in 2015, what happens is that becomes a 50% tax credit using the same calculation. And so the idea, or what I believe the idea is, that Congress had in mind in this was we have small employers, we need them to provide health insurance. To do that, we're going to give them a tax credit to incentivize them to do it. Basically 35% the first 4 years, 50% the next 2 years. After that, the tax credit goes away. And I think the idea is, well, at that point, they'll be used to providing health insurance for their employees. In my opinion, you're kind of setting your employer up to have a disagreement with their employees. Because how many of you in the room know that after 6 years of having health insurance, if all of a sudden your employer said, you don't have it anymore because I can't afford it, I don't have this tax credit anymore, your employees aren't going to be happy. One caveat to that calculation I wanted to be sure and mention was it excludes owners and the owner's family. And so you could have a situation where you have more than 25 employees, but yet you still qualify for the credit because you ignore owners' compensation and owners' hours and their family. And in the tax code, there are 2 different sets of rules that determine who related parties are or who family is. And this is the more broad definition. So this includes stepchildren, step-parents, it includes in-laws. And so if you have a family-owned business where lots of family members are involved, you could actually have a somewhat sizable company and still qualify for the credit because they get excluded completely from the calculation. So that's the tax credit. Like I said, that's going to be there through 2015 for small employers.